Ambulances serve approximately 98% of the state of Arkansas, and a lot of times they're the only outlet for any type of medical care for people in need. They say they are struggling, though, and they have been for a while.
The Arkansas Ambulance Association came to lawmakers today to lay out their concerns. Jay Burr was there, and he joins us with more on what the discussion was that they had today. Any outcome, Jay?
Well, no outcome today, but much like other industries, ambulance services in Arkansas dealing with staffing issues along with a myriad of other things. The Ambulance Association said this is the first time they're taking their concerns to lawmakers because they're reaching their breaking point.
We're looking for sustainability.
The Arkansas Ambulance Association met with lawmakers on Monday to address concerns.
We're taught to handle emergencies. We're taught to adapt, to overcome, to improvise. But today, we must sound that alarm.
Much of it had to do with a drop in revenues. Federal law dictates ambulances must bill for transport, but the number of transports have decreased by 36%, while calls have actually increased by 24%.
Now we're often treating patients in place, not transporting to hospitals, but that is done so at an uncompensated care cost.
Ambulance officials said they don't get much in the way of county or municipal funding to provide service, and they have been left out of much of the funding packages coming down from Washington.
While hospitals have received millions of dollars to fund critical staffing and increased bed capacity, ambulance services have received nothing, and we're providing the volunteer labor.
Staffing has become a burdensome issue since the pandemic began. Even if current trainees get into the field, there is still a net loss of employees. And starting salaries, which begin at $14 an hour, and the ARAA says they need to be bumped up.
The paramedic is now, everyone has figured out they are the Swiss Army knife of healthcare professionals. They can do just about anything, and we as ambulance providers can't pay them what they're worth.
They hope a waiver from DHS will change transport billing, and hopefully that can help stop the bleeding when it comes to the workforce.
We don't come with our hand out without being able to work at the same time. We're not asking for anything for free. We're willing to do our portion of the work to take care of our Arkansans.
And again, no action items voted on today, but this is definitely something that you'll want to keep an eye out when the fiscal session does begin, and that starts next Monday.